Hi, Moyne here. Today I want to answer the question, what does holistic health mean anyway? It means different things to different people. Different people think of different things when they hear that term. So I'm going to tell you what it means to me and what my definition of it is. When I think of the word holistic, to me it means whole, like looking at a whole thing. And when we talk about health, we're talking about the whole body and looking at the whole body as a system that all works together. And so when we think about health, we're basing it on that holistic system and looking at the body as a whole, a body that has the ability to heal itself if we can help it. Sometimes when we talk about holistic health and we're trying to understand exactly what that means, it helps to talk a little bit about what it's not. Now, if you go to a regular doctor, an MD that's graduated from medical school, we call that allopathic medicine, A-L-L-O, allopathic. And that is based on the premise that something is wrong in the body that we have to suppress it, we have to stop it. Meaning if the body is having one certain symptom, then we're going to do something that creates the opposite effect. So if there's inflammation, then it usually has to do with prescribing a drug, a chemical that suppresses inflammation. So it's looking at a symptom, something that you're complaining about that you have a problem with, and choosing something to cause an opposite reaction to just stop that symptom. And it generally looks at symptoms a lot of times as the problems. Okay? It also tends to look at your body as if it's bad or wrong. It's a problem. It's causing a problem. It's doing something that you don't want it to do, and so you have to stop it. It often talks in terms of fighting, like we want to kill germs, fight cancer, kill disease. And sometimes it can kind of seem like you're playing whack-a-mole because if you have this one symptom, so you take a drug or you do this treatment to suppress that, and so something else pops up, and so then you try to deal with that, and then this other thing pops up, which could be a side effect from one of the other drugs, or it could just be your body's still trying to get the message out, and so something else kind of comes up. But one of the things with playing whack-a-mole is if you keep all the moles from being able to pop up, what's going to happen eventually? It's going to break, right? It's just going to self-destruct because you can't just, it needs to do that. And the way that holistic health tends to look at the body and the signals, the symptoms that it might produce, is that they are signals of something else that's going on. And so in a holistic manner of looking at the whole body and everything that's going on, then we want to see what's underlying, what's causing this to happen in the first place. Holistic health usually is talking about bringing the body into balance because it's based on the idea that if the body is having a problem, something that's making us uncomfortable, discomfort, pain, dis-ease, that's our body's signal that something's out of balance, because our body does have natural healing mechanisms. It has a beautiful, amazing immune system and all kinds of ways to heal itself. But what happens is that often we do things in our society, in our world today, in our lifestyle, that cause our body to be out of balance, whether it's what we're eating, the way that we're sleeping or not, the way that we're exercising or not, and different things like that that can throw our body out of balance, and then our body's only recourse is to send up a signal and say, hey, hold it, something's not right here, so that we can then figure out what it is and try to help it. So one way to look at this would be an analogy of maybe a newborn baby. So when you think of a newborn baby, the baby pretty much only has one way to communicate with us, doesn't it? The baby can cry, and then it's up to us to figure out if the baby's hungry, if the baby needs a diaper change, the baby just needs help, the baby needs his big brother to stop poking him. Whatever it is, the cry is the signal something's wrong, and then it's up to us to go figure out what that is and to fix the situation so the baby can stop crying. Now, in that example, is the crying the problem? No, it's not, is it? It's just the signal. It's just the signal that something else is going on. If the crying were the problem, if the symptom were the actual problem, then you could say the answer to that would be to just stop the baby crying. I mean, you could put your hand over a baby's mouth and make it so that you couldn't hear anything, but would that mean that the problem was gone? My sister actually told me of her friend one time coming home from work to find that her husband had duct taped her baby's pacifier in his mouth so that it couldn't fall out and he couldn't cry. And as horrifying as that sounds, especially to moms, you know, that was kind of what that was. And yet, isn't that often what we tend to do to our bodies, at least when we're looking at them from an allopathic standpoint? Our body's sending up this smoke signal. It's doing everything that it can, that it knows, to tell us that something's wrong and ask us to fix it. And so often our answer is just to stop it up, to suppress it, to just try to suppress that, and as if that's the problem, instead of looking underneath to see what's going on. So one common signal that our body has to tell us that something's wrong is a headache. And maybe that's because that's one thing that we'll pay attention to. How often do we really pay attention to some of our body's more subtle signals that something's out of balance? You know, we tend to just have an idea of what we want to do, and we want to keep doing it, and we don't want to be interrupted, and we don't want to stop and take time to, you know, listen to our bodies or figure out what's going on. And so we do just, you know, not pay much attention. A headache is kind of a bigger signal that can be more difficult for our bodies to ignore. And so that's that's something that pretty commonly people have to deal with. But often in our society, people just take something to suppress the pain, something to stop the inflammation or whatever it is, just deaden the pain so that they can keep on going and keep on doing what they've been doing, which has been causing probably an imbalance in the first place. This is why the body said help and gave you a headache, to try to get you to stop and figure out what's going on. So in allopathic medicine, generally the answer is to take a drug, whether it's something over the counter or it's something stronger from a prescription. Just suppress it and get on with life, okay, right? But from a holistic standpoint, there can be so many things that can be at the root of why somebody would have a headache. So when we look at what's causing an imbalance to cause a headache, there's a lot of different possibilities. Sometimes it is something that is out of balance in the way we're eating or sleeping, exercising, like that. It can also be a symptom that, or signal, that something's going on with one of our body's many energy systems. For example, in traditional Chinese medicine, which recognizes the energy meridians that we often associate with practices like acupuncture and acupressure, often headaches are classified as to whether they're a stomach, liver, gallbladder headache, or bladder headache. And that's because the headache is actually a signal that one of those meridians has some kind of blockage, some sort of interference. That's where the body is struggling, is in one of those energy systems, and the headache is associated with that. So depending on what type of a headache it is, where the headache is, can be one way to discover which meridian it is that needs help, and then be able to help that meridian and stop the headache. For example, just the other day, one of my sons had a headache, and when I checked it out, his stomach meridian was out of whack. It was being challenged, and that's why he had the headache. And so he came to me complaining of the headache, following the signal, and we were able to figure out what was going on and be able to support his body to just come back into balance, and then be able to feel better and to take care of that itself. Another example of the different ways of looking at something that presents as what we consider to be a symptom of pain would be an earache. You know, we deal with that with children all the time. I'm sure most moms have had the experience of having a child wake up in the middle of the night screaming, crying that their ear hurts. And if you're looking at it from the normal allopathic medical route, usually, right, you take them to the doctor in the morning, doctor's going to prescribe an antibiotic. But one of the things with that is that that antibiotic that's intended to kill germs, kill bacteria inside the ear canal, because that's what the doctor looks at as being the cause of the problem, doesn't just kill the bacteria that is causing the pain. It kills all types of bacteria in your whole body, including the good bacteria, which is a very important part of your immune system. So from a holistic standpoint, that doesn't necessarily make a lot of sense, because if your body is trying to deal with an infection, why would we want to damage the immune system, which is what it needs to actually fight the problem and balance it and take care of it by itself? And so I've often heard an analogy for that, and the way that in our country we so quickly jump to using antibiotics for everything. It is kind of like burning down the house to get rid of the termites. Okay, yeah, you can do that, and it will get rid of the termites, but what are you going to have left? And sometimes antibiotics can have that result depending on how they're used. So if you were going to look at an earache from a holistic standpoint, again, all kinds of things can be causing it. One of my children had a lot of problems with earaches, and ear infections, and it had to do with a milk allergy. Food allergies are a huge underlying cause. Not just food allergies, and also often environmental allergies can be also. But it's very, very common for a lot of different food allergies to be a underlying cause for ear infections, because it causes inflammation, causes that eustachian tube to swell shut so that the bacteria can't, and fluid can't normally flow through there, and then it gets trapped in there. The bad bacteria gains ground and grows, and then you have the pressure on the eardrum that causes the pain. Another common cause, which I've also seen in my children, for that was whenever my daughter would have a bad fall, learning to skate or something like that, she would wake up often in the night crying that she had an earache. But we learned, instead of taking her to the doctor, in that case, often I would take her to the chiropractor, and especially when I noticed that, oh wow, yeah, she had that fall yesterday, here we go again. And it was because she had kinked her neck. She'd subluxated her spine in her neck, and so that was then kinking her eustachian tube. And as soon as she would get her neck adjusted, she would just relax. She'd fall asleep in the car and on the way home, and then she was better after that, and without any other intervention, just in supporting her body was able to take over and to heal that. And there's so many other things that can be an underlying cause for an earache, and those are just a couple. But just as an example of a different way of looking at a common thing that people often deal with, and just a different way to look at it from a holistic standpoint of what we mean when we're talking about holistic health. Now, an example of something that we tend to see more in adults, although in our culture right now it's happening at younger and younger ages, and even children are starting to have problems with, would be type 2 diabetes, meaning lifestyle cause, which is the vast majority of diabetes in our country, because that's caused by lifestyle. We're not talking about type 1 diabetes, like you're born without a pancreas or some type of, born with something not working right there, but something that comes on later in your life because of the way that we treat our bodies, that then diabetes happens. And a lot of people, I think, like to look at it as in, well, I'm just getting older, so, my metabolism's just older, and so now I have diabetes, and that's not really what causes it. The reason that we have traditionally seen it in older people is because your body really works hard to keep itself in balance. And there's all these different factors and all these different parts of your body, physically and energetically, energy systems that are all working together to keep your body in balance. And it does a really good job against a lot of difficult odds sometimes. And so if your body is trying to keep in balance, and then there's a problem somewhere, and something gives out, then all your other systems kick in to work together to try to bring it back into balance. And your body can continue to do this for a significant period of time, and can give you the illusion that everything's fine, especially if you're not paying attention to the little signals. But eventually, when we just continue to mistreat our body, not listen to it, and not give it what it really wants and needs, eventually the system is going to shut down, and then you really see it. By the time something like diabetes is obvious. It's been going on for so long that there's all kinds of things that have to be fixed in order to bring your body back into balance. And so, yeah, a lot of times by the time diabetes is discovered, your body has such a hard time. Either it has insulin resistance so badly that no matter how much insulin your pancreas makes, it's not going to be enough because your body just can't even register it anymore. Or your pancreas is so tired that it really physically cannot make the insulin that it needs. Then okay, yeah, you're probably going to need a prescription for insulin and or something to help your body to recognize the insulin that's there. However, does that fix the problem? Of course not, because there's still stuff underlying causing the problem, and there's all kinds of different things that can help the situation depending on your individual body and what's out of whack. But that's always, by the time you get to that, there have been lots of other signals along the way that have been ignored to help your body come back into balance by the time it gets to that point. But there are ways still, even at that point, to heal your body, to bring it into balance and allow it to heal itself and come back into balance so that diabetes is no longer an issue. So when we talk about looking at our bodies from a holistic health standpoint, from a holistic point of view, we're looking to see what things are out of balance in the body that we can take care of and fix to allow our body to heal itself, and just taking the time to do that instead of just looking for a quick fix or looking at something to suppress it. It's actually supporting our body to do its job that it was intended to do. So hope that was helpful, and that's all for now. Bye.